Welcome to the deep dive. We're tackling a really interesting area today, hyperbaric oxygen therapy, or HBO, and its potential to help with cardiovascular diseases.
Yeah, it's a fascinating topic.
We've looked at a whole range of studies and research to bring you the core insights on how boosting oxygen in the body might, impact heart health.
Hmm.
So if you're keen to get a solid understanding without getting sort of bogged down in jargon, you're definitely in the right place.
Exactly. And cardiovascular diseases, well, they remain a huge challenge, right? So exploring any potential new tool, even maybe as an add-on to existing treatments, is pretty crucial.
Absolutely.
Our sources today, they span from lab experiments, animal studies, right through to real-world clinical experiences.
Right.
And our goal really is to understand the evidence.
Yeah.
Where does HBO actually show promise for different heart conditions?
Okay, so let's get straight to it then. What exactly is HBO therapy? I mean, we know about regular oxygen therapy, but this sounds, well, different.
It is, yeah. Hyperbaric oxygen therapy. It involves breathing pure, 100% oxygen in a special chamber where the pressure is actually higher than normal atmospheric pressure.
High pressure.
Think of it like maybe going underwater a bit. That increased pressure lets your body absorb significantly more oxygen than it normally would.
Ah, okay.
And that's different from, say, normal baric oxygen therapy, where you breathe extra oxygen, sure, but the pressure stays the same as, everyday air pressure.
Got it.
So given that many heart problems involve a lack of oxygen getting to the tissues, the whole idea is that HBO can kind of flood the body with oxygen, even reaching areas with poor blood flow.
That makes a lot of sense. So how does this extra oxygen, how does it actually affect our heart health? I know one of our sources mentioned hypoxia, that lack of oxygen.
Yes, hypoxia.
Yeah.
It's really deeply involved in the development of atherosclerosis. That's the hardening of the arteries, a major cause of heart disease.
Right, the plaque buildup.
Exactly. For example, there were studies on rabbits with high cholesterol. They showed that when these rabbits were kept in low oxygen conditions, the plaque buildup in their arteries actually got worse.
Wow.
But here's where it gets interesting. When those same studies used HBO therapy, this plaque buildup apparently started to reverse.
Reverse.
Yeah. And it wasn't because their cholesterol levels changed. It really seemed to be a direct effect of the high oxygen environment on the artery walls themselves.
Hmm.
So that suggests HBO might be tackling one of the sort of root causes of atherosclerosis at a molecular level, going beyond just delivering more oxygen.
Wow. Okay, so it's not just about delivery, it's actively doing something beneficial. Our notes also mention an antioxidant effect.
Right, exactly. Research indicates that HBO might act as a powerful antioxidant.
Okay.
One study, again in rabbits, it even found that HBO significantly reduced the levels of these harmful things called autoantibodies. They attack damaged cholesterol in the arteries.
I see.
And because oxidative stress is such a big driver of atherosclerosis,
Yeah.
this antioxidant response could be a really key reason why HBO might be beneficial.
Interesting. What about when a blood vessel gets injured? How does oxygen come into play there in the healing process?
Yeah, good question. Another rabbit study looked at how the inner lining of a blood vessel heals after an injury.
Hmm.
And they found that when oxygen levels were low, the healing process was, less organized. You got more blood clotting, excessive cell growth in the vessel wall.
Not ideal.
Definitely not. It suggests that not having enough oxygen after, say, a vascular event could lead to less favorable healing.
Right.
But on the flip side, HBO has shown some effects on the immune system that might actually help create a more controlled and effective healing process in that vessel lining.
Okay, so potential for preventing plaque, maybe even reversing it, and better healing after injury. What about just how our blood vessels normally work? I saw something about oxygen-sensitive mechanisms.
Yes, that's right. In our peripheral arteries, like in our arms and legs, there seem to be two different systems that respond to oxygen levels and control whether the vessels narrow or widen.
Two systems.
Yeah, one system kind of kicks in when oxygen levels are high, causing the vessels to narrow, vasoconstrict. And this seems linked to the production of certain compounds, prostaglandins.
Okay.
The other system activates when oxygen is low, and it's more related to the cell's energy production, its metabolism.
So like sensors?
Sort of, yeah.
Hmm.
Think of it like your body having two different oxygen sensors controlling the pipes. One tightens them when there's maybe too much oxygen locally, and the other loosens them when there's too little energy because of low oxygen.
Hmm.
And this is important because while we know that too little oxygen can be bad for blood vessels, the extra oxygen from HBO might actually help counteract those negative effects, especially in areas already affected by blockages.
That's a really key distinction. And there was a mention somewhere about combining HBO with vitamin E.
Exactly. Vitamin E, well, it's a well-known antioxidant, right?
Right.
A study on rabbits with high cholesterol found that when they were treated with both HBO and vitamin E, it was even better at lowering levels of harmful cholesterol in their blood than either treatment on its own.
Interesting synergy.
Yeah, it suggests that HBO might work well with other antioxidant therapies to, potentially improve heart health.
So we've talked a lot about the vessels. What about the direct impact of all this extra oxygen on the heart muscle itself?
Yeah, several studies have looked into this. In healthy people, being a low oxygen environment, hypoxia, it seemed to make the heart contract more strongly,
Or strong.
possibly due to the release of adrenaline, that fight or flight response.
Okay.
Conversely, breathing extra oxygen, hyperoxia, appeared to have more of a calming effect on the heart, what's called a vagatonic effect, potentially slowing the heart rate down.
Right.
Experiments on dogs in high-pressure chambers showed something similar. While breathing regular air at high pressure didn't do much, breathing pure oxygen at those high pressures tended to slow down the heart and reduce blood flow in some arteries.
That sounds like it could be a bit of a concern, a slower heart rate, and maybe less blood flow.
Well, it's important to remember these are often immediate effects in very controlled settings. For example, when someone exercises while breathing extra oxygen, the usual narrowing of blood vessels in the limbs doesn't seem to happen as much, probably because the working muscles desperately need that extra blood flow.
The body compensates.
It seems so. And interestingly, the heart rate during exercise in these high oxygen environments is often lower.
Lower. Why is that?
It's likely because the higher oxygen levels directly affect the heart muscle itself, and they also seem to increase the activity of the parasympathetic nervous system. That's the part that slows things down.
So the body definitely has ways of adjusting. What about when the body is just at rest in these high oxygen conditions?
Studies on healthy volunteers breathing pure oxygen in hyperbaric chambers have generally shown a decrease in cardiac output, the amount of blood the heart pumps out each minute. And this is mainly due to the heart beating slower, like we said, and maybe each beat being slightly less forceful.
Right?
On the other hand, when oxygen levels are low, the heart tends to pump more blood, mostly because it beats faster.
Makes sense.
More detailed measurements, specifically at 2 times normal atmospheric pressure, 2 ATA, showed a slight decrease in how much blood the heart pumps relative to body size. That's the cardiac index. They also saw an increase in vascular resistance, a decrease in the work the left side of the heart has to do, and maybe a small increase in average blood pressure.
So it sounds like flooding the system with oxygen definitely has some, well, measurable effects on how the heart operates day to day, or minute to minute, rather.
It certainly does. And it can even change how the heart and blood vessels respond to other substances circulating in the body.
Oh, like what?
For instance, in dogs breathing pure oxygen, they became much more sensitive to angiotensin I-9-2.
The renin-angiotensin system.
Exactly. Key parts of the system that regulates blood pressure and fluid balance. So this suggests that high oxygen levels can actually amplify the influence of this system on how the heart and blood vessels work.
Okay, let's switch gears slightly now and talk about the heart's energy supply. Oxygen is obviously critical for that, right?
Absolutely critical. The heart muscle, it needs a constant, reliable supply of oxygen to produce ATP, that's its main energy currency.
Right.
This energy production happens in the mitochondria, the powerhouses of the cell, and it's directly dependent on how much oxygen is available. That's why the heart relies so heavily on the blood's ability to carry oxygen.
So HBO must help there.
You'd think so. And one really interesting study, this was on pigs, it even found that using HBO at 3 times normal atmospheric pressure could potentially make up for an almost complete lack of hemoglobin.
Wow, hemoglobin, the oxygen carrier.
Yeah. Without the heart showing signs of oxygen shortage on an ECG, it's almost like HBO provides a backup system, letting oxygen dissolve directly into the blood plasma under pressure, bypassing the need for red blood cells in extreme circumstances.
That's quite remarkable. What about when the heart muscle is already under strain, like in a condition called myocardial hypertrophy, where the muscle thickens?
Yeah, that's another interesting area. Research on rabbits with this thickened heart muscle suggests that HBO can actually help restore the normal sensitivity of a key signaling system in the heart, the adenylate cyclase system, to hormonal signals.
Okay, and why is that important?
Well, certain molecules called guanine nucleotides seem to be involved in this process. And when this signaling system isn't working properly, the heart's ability to respond effectively to stress can be quite impaired. So normalizing it could be beneficial.
And for patients who are having, say, acute heart problems like sudden heart failure.
In patients with sudden severe heart problems, the benefits of HBO often seem to start with direct effects on the tissues in the rest of the body, the peripheral tissues, before we see big changes in the overall circulation, like cardiac output.
So it helps the body first?
Kind of. By improving blood flow and how these tissues use oxygen locally, HBO can help break a really dangerous cycle where the heart and the rest of the body aren't getting enough oxygen.
I see.
And we see evidence of this in things like reduced levels of harmful substances like lactate and a decrease in metabolic acidosis, often without significant changes in how much blood the heart is pumping initially. So it's like HBO helps the periphery get the oxygen it desperately needs, which then indirectly takes some strain off the struggling heart.
Okay, now, one of the biggest areas people are probably curious about is myocardial infarction heart attacks. What does the experimental research in animals tell us about HBO's potential role here?
Right, heart attacks. The findings from various animal studies, which are actually summarized nicely in one of our source tables, they're quite promising, I have to say.
Oh.
Across different animals, dogs, rabbits, rats. HBO has shown potential in several key areas. It's been linked to lower mortality rates after a heart attack.
Just big.
Smaller areas of damage to the heart muscle, so smaller infarct sizes, improved energy use in the damaged tissue, and even making other treatments, like clot-busting drugs and antioxidants, work better when they're used together.
So a multi-pronged benefit, potentially.
Exactly. These animal studies provide a pretty strong rationale for exploring HBO further in human heart attack patients.
That does sound really encouraging. Were there any particularly interesting recent findings in these animal models?
Yes, actually. A more recent study on rats looked at giving just a single session of HBO at 2 times normal pressure, only 3 hours after a blockage was created in a coronary artery.
Okay, what did they find?
They found it seemed to have a beneficial effect, possibly by helping to redistribute blood flow within the damaged area, sort of favoring the tissue that was still alive, but oxygen-starved the ischemic zone over the tissue that had unfortunately already died, the necrotic zone.
Ah, interesting. Helping the salvageable tissue.
Precisely.
But our notes also mention that there have been some conflicting reports about how helpful HBO actually is for heart attacks. Why might that be? Any ideas?
That's a really important point to consider, yeah. It seems that how effective HBO is in a heart attack might depend quite a bit on the size of the damaged area.
The size of the infarct.
Exactly. The amount of heart tissue that HBO can potentially help save might not increase proportionally with the initial size of the damage. Some research suggests that HBO might be most helpful when there are multiple smaller areas of damage rather than one single, very large area.
Okay.
And this could explain why some experimental results have varied. The size of the heart attack induced in the animal models might have differed quite a bit between studies.
That makes sense. Maybe a more widespread, patchy problem benefits more from a systemic increase in oxygen delivery? And the idea of combining HBO with clot-busting drugs seems particularly promising, given what you mentioned earlier from the animal studies.
Absolutely. Yeah. Several animal studies have indicated that using thrombolytic therapy, the drugs that aim to dissolve blood clots and restore blood flow along with HBO, is actually more effective at reducing the size of the heart attack than using either treatment on its own.
A 1-2 punch.
You could say that. It suggests that HBO might help get more oxygen to the struggling heart tissue while the clot-busting drug is working to physically reopen the blocked artery.
This all sounds very positive in the lab setting. So what does the evidence look like when we move to real-world use in humans? Let's start with acute myocardial infarction. That's a heart attack happening right now.
Right. Acute MI, or more broadly, acute coronary syndrome, ACS. It's a leading cause of death, and getting treatment fast is absolutely vital.
For sure.
Now, while regular oxygen, normobaric oxygen, is often given to heart attack patients, especially if their overall blood oxygen levels are low, it's probably unlikely to significantly help the specific area of the heart that's starved of oxygen because of that blocked artery.
Because the blockage is the main problem.
Exactly. And this is where HBO has been investigated. Some of the earliest studies, like one back in 1966, observed that while HBO could increase the resistance in blood vessels and slightly reduce cardiac output, it did seem to lower levels of lactic acid in some patients.
Lactic acid, the byproduct of low oxygen.
Right, which hinted at a possible benefit in very severe cases, maybe those with critically low oxygen levels and metabolic acidosis.
And what about the first controlled study in humans? That would be a really important piece of the puzzle, wouldn't it?
It would, and that was done in 1973 by Thurston and colleagues. They compared outcomes in heart attack patients who received standard treatment alone versus standard treatment plus HBO.
And the results.
Their findings suggested that fewer patients actually died in the HBO group, especially those who were considered high risk to begin with.
Fewer deaths? That's significant.
Yes. And the HBO group also seemed to have fewer problems with serious irregular heartbeats. Plus, interestingly, some patients with cardiogenic shock, that's a very severe complication where the heart can't pump enough blood, survived in the HBO group, which wasn't seen in the control group in that study.
Wow, that's a pretty striking finding from an early trial. Were there other notable studies in humans after that?
Yes, there were. A study by Yafuni and colleagues in 1984 reported that patients with heart attacks who also had low oxygen levels, hypoxemia, and received HBO as part of their treatment showed improvements. They saw better oxygen levels in their arteries, their heart's pumping ability improved, and there was a reduction in that metabolic acidosis we mentioned.
Okay, so more supporting evidence.
And then more recently, a big systematic review in 2015 looked at several of these smaller clinical trials together.
What did that find?
This review found some evidence suggesting that HBO might be associated with a lower risk of death, maybe less damage to the heart muscle, fewer major adverse cardiac events, and possibly quicker relief from chest pain in patients with ACS.
Sounds pretty positive.
It does, but, and this is important, the authors of that review were careful to point out that the studies they looked at weren't always the highest quality or the largest.
Ah.
The usual caveat.
Right. So they concluded that we really need more well-designed, large-scale randomized controlled trials to know for sure who would benefit most from HBO in this situation and how significant that benefit is.
So definitely seeing some promising signals in humans, but more solid research is needed.
Yeah.
What about combining HBO with those clot-busting drugs in people? You mentioned the animal studies were encouraging.
Yes, several initial pilot studies have explored this combination in humans. Studies back in 1997 and 1998 looked specifically at whether it was safe and practical to add HBO to standard thrombolytic treatments like RTPA or streptokinase for acute heart attacks.
And was it safe? What did they see?
Generally, yes, it appeared feasible and safe. And these early studies showed some positive signs, too. Things like lower levels of CPK, that's a protein released when heart muscle's damaged.
Right, a marker of damage. Faster relief from chest pain, quicker improvement in ECG readings, and potentially better heart pumping function, measured by ejection fraction, although that last point wasn't always statistically significant in these small trials.
So encouraging first steps.
Exactly. These initial trials kind of pave the way for potentially larger studies looking at this combination approach, though more definitive evidence is still needed here, too.
Now, moving beyond the immediate heart attack scenario, what about chronic ischemic heart disease? That's things like ongoing chest pain or angina pectoris.
Right, angina. It happens when the heart muscle isn't getting enough oxygen, usually because the coronary arteries are narrowed by atherosclerosis.
The supply-demand mismatch.
Precisely. And while standard treatment involves lifestyle changes and medications to improve blood flow or reduce the heart's workload, HBO has also been investigated here. A study back in 1979 reported that when HBO was used along with regular medications, it helps reduce angina symptoms and improve hemodynamics, that's blood flow dynamics, in patients with chronic ischemic heart disease.
Interesting. And were there studies looking at longer-term benefits, maybe during the recovery or rehabilitation process?
Yes, there were. Research in 1981 looked at patients undergoing cardiac rehabilitation after heart problems. They found that those who received HBO, in addition to the standard rehab program, showed greater improvements in their overall well-being, reported less angina, had fewer irregular heartbeats, and showed a better ability to handle physical activity compared to a control group that just did the rehab.
So, potentially boosting the effects of rehab.
It seemed so in that study. Another study in 1984 used a specific type of exercise testing, isometric testing, to objectively show that HBO could reduce the severity of angina in patients with chronic heart ischemia.
Objective measures are good.
Definitely. Furthermore, studies in 1986 indicated that HBO could help reduce the stickiness of platelets and lower levels of fibrinogen, a clotting protein in the blood, both factors that can contribute to angina. And these researchers found that HBO was clinically effective in a significant percentage of their angina patients.
So it seems HBO might have a role to play in both managing the immediate symptoms and perhaps improving the longer-term outlook for people with these chronic heart problems. What about issues like irregular heartbeats, cardiac arrhythmias?
Yeah, that's another area where HBO has been looked at. It's interesting to note first that a slight slowing of the normal heart rhythm, moderate sinus bradycardia, can actually be a normal physiological response to HBO.
Okay, so slower isn't always bad here.
Not necessarily.
Hmm.
And as we mentioned earlier, during HBO treatment for acute heart attacks, some researchers have observed improvements in pre-existing arrhythmias.
Right.
Beyond that, there are individual case reports and some research suggesting that HBO might help clear up abnormal heart rhythms seen on ECGs after things like electrical shock,
Wow.
resolve rhythm and conduction problems in patients after a heart attack, reduce how often and how long certain fast heart rhythms like paroxysmal tachyarrhythmias occur, and even eliminate troublesome extra heartbeats or extra systoles in some patients with ischemic heart disease.
That's quite a diverse range of potential antiarrhythmic effects. What about more severe conditions like heart failure?
Well, heart failure, as you know, can often be a long-term consequence of a major heart attack.
Right, the damage accumulates.
Exactly. Now, there's research showing that HBO can trigger the body to produce protective proteins called heat shock proteins, or HSPs.
Heat shock proteins.
Yes, these proteins can help cells withstand various kinds of stress and repair damage. This has led to the suggestion that HBO might have a role in helping to repair and maybe improve the function of hearts that have been damaged by a heart attack and have progressed to heart failure.
So stimulating the heart's own repair mechanisms.
That's the idea, although this is definitely an area where more specific research is needed to confirm clinical benefit in heart failure patients.
And in the most critical situations, like when someone's heart stops cardiac arrest and resuscitation.
There was a study on dogs looking at using HBO at 2 times normal pressure during external chest compressions for cardiac resuscitation.
Okay, what did they find?
They found that while it didn't directly make the heart contract more strongly, it did increase the cardiac output, the amount of blood the heart was pumping, and importantly, the blood flow to the brain via the carotid arteries.
Better brain perfusion during CPR.
Exactly. This suggests that HBO could potentially be useful in human cardiac resuscitation, particularly in helping to deliver much-needed oxygen to vital organs during that critical time.
Okay, let's move on to a major area that sounds potentially really impactful. Using HBO as an extra tool, an adjunct, during heart surgery.
Yes, this is a really significant area of investigation. Way back in 1961, Dr. Boerema was one of the pioneers, exploring the use of hyperbaric chambers for cardiac surgery.
So this isn't a new idea.
Not at all. And the potential benefits are quite significant. Think about it. Reducing how severe low oxygen levels and slow heart rates become during the operation.
Which must happen sometimes.
Oh, yes. Also, allowing for faster and better oxygenation of tissues once blood flow is restored after being stopped, and maybe making it easier to resuscitate or defibrillate the heart if needed during the surgery itself.
Those all sound like they can make a big difference, especially in complex or high-risk heart surgeries.
Absolutely. They are all crucial factors.
What does the research in the lab, the experimental work, show about this?
Well, studies on dogs have looked at finding the optimal conditions for protecting the heart muscle during surgery under HBO. Some suggested that a pressure of about 3.5 times normal atmospheric pressure for maybe 60 minutes might be optimal.
Okay.
Research has also explored using a combination of cooling the heart, hypothermia, and HBO to preserve hearts that are being transported for transplant, trying to keep them viable for longer.
Makes sense.
One interesting dog study found that using HBO immediately after restoring blood flow to a coronary artery that had been temporarily blocked significantly reduced the area of subsequent heart damage and also helped suppress dangerous ventricular fibrillation.
Preventing those post-blockage complications.
Right, and there's even older research suggesting that with HBO combined with cooling, the body might be able to tolerate a complete stop of blood circulation for up to an hour during surgery without causing irreversible damage.
An hour with no circulation? That's incredible.
It is, but highly experimental, of course.
And I know that when blood flow is stopped and then restarted during surgery, like in bypass, it can sometimes cause its own type of damage. That's ischemia-reperfusion injury, right? Does HBO have a role there?
Absolutely, you're spot on. Ischemia-reperfusion injury is a major concern in procedures like coronary artery bypass, grafting, or CIBG.
So how could HBO help?
There's growing evidence that exposing the heart to HBO before the period of reduced blood flow, a process called HBO preconditioning, can actually have a protective effect.
Preconditioning, like preparing the heart.
Exactly. Animal studies have shown that this preconditioning can limit the size of the subsequent heart damage, the infarct size.
How does it work?
The proposed reasons are interesting. It might involve HBO, helping the body produce more nitric oxide, which improves blood flow and reduces inflammation, and also activating protective antioxidant pathways within the heart cells.
So almost like boosting the heart's natural defenses before the surgical stress. What about the actual experience in human heart surgery? Have doctors used this in the operating room?
Yes, they have. There are reports highlighting the value of HBO in resuscitating patients during tricky cardiac surgery situations, and it's even been used successfully during childbirth for women with certain heart conditions, reportedly without complications.
Wow.
Dr. Bakuria and his team in Russia did extensive work performing bypass surgery while the patient was actually inside a large hyperbaric chamber.
The whole surgery in the
Yeah.
chamber.
They reported good outcomes, good hemodynamic and biochemical indices. And interestingly, they noted the possibility of performing the surgery without needing donor blood transfusions when operating at 3 times normal pressure.
That's a huge potential benefit.
It is. Although they did also caution about the risk of air bubbles, air emboli, forming when the pressure is reduced after the surgery. So decompression has to be managed very carefully.
Right. A critical detail.
They also found less evidence of heart muscle damage based on enzyme levels after surgery performed under HBO in patients with congenital heart defects compared to standard surgery. Other researchers have looked at how HBO affects venous pressure during open heart surgery and suggested it might help prevent neurological problems.
The idea of reducing the need for blood transfusions during open heart surgery with HBO sounds pretty amazing, potentially game-changing.
It really is. The ability to safely dilute the patient's blood quite significantly under HBO because the plasma carries so much dissolved oxygen without causing oxygen deprivation is a big advantage.
And then you give the blood back.
Exactly. The withdrawn blood can be given back to the patient later, which can help with clotting and also improve blood flow in the small microvessels.
So, summing up the surgical benefits.
Overall, using HBO as an adjunct in cardiac surgery seems to offer several potential advantages. It might increase the amount of safe time the heart's blood supply can be stopped, reduce the impact of complications related to low oxygen and metabolic issues, potentially allow for surgery without blood transfusion in some cases, provide a treatment option for air embolism if it occurs, help manage low cardiac output syndrome after surgery, and potentially reduce neurological problems and inflammation after bypass surgery, though more research is still needed to confirm some of these latter points definitively.
And what about that idea of preconditioning in human heart surgery? Is there solid evidence that exposing patients to HBO before their bypass surgery actually helps?
Yes, there's certainly accumulating data supporting the benefits of HBO preconditioning in patients undergoing CABG, specifically to help lessen that ischemia-reperfusion injury we talked about. Animal studies suggested mechanisms like increasing protective proteins via certain cellular pathways. And importantly, a randomized clinical study in humans showed that patients who received HBO preconditioning had better left ventricular function, a measure of the heart's pumping strength 24 hours after their bypass surgery.
Better function, that's key.
Yes. And they also found higher levels of those protective markers like ENOS and HSP72 in the heart tissue after the period of ischemia and reperfusion in the HBO group, strongly suggesting that HBO did indeed induce a cardioprotective effect.
Interesting. Are these findings being applied?
Well, studies done outside the U.S. have pointed to potential clinical and even cost benefits of HBO preconditioning for planned, non-emergency bypass surgeries. Things like improved heart function, shorter stays in the intensive care unit, ICU, and fewer complications. However, researchers are really calling for a large, well-conducted study within the U.S. to confirm these findings and potentially guide clinical practice here.
We've covered a lot about the heart itself during surgery. What about potential brain-related complications that can sometimes happen after heart surgery? Does HBO play a role there?
That's another important consideration. Unfortunately, neurological complications like stroke or more subtle brain injury can sometimes occur after CABG.
Right.
One prospective randomized study looked at giving patients HBO preconditioning for 5 days before their planned on-pump bypass surgery.
5 days of HBO beforehand.
Yes, and they found that this preconditioning led to lower levels of certain proteins in the blood right after surgery, proteins like S100B and neuron-specific enolase, which are markers of brain injury. They also saw lower troponin I, a marker of heart damage.
So protection for both brain and heart.
It appeared so. These patients also had shorter stays in the ICU and needed less medication to support their heart function compared to the control group.
Significant findings.
Interestingly, though, These benefits weren't seen in patients who had off-pump bypass surgery, suggesting the protective mechanism might be specifically related to the stresses of the heart-lung machine used in on-pump procedures.
Hmm.
And it's also worth mentioning that immediate HBO therapy, sometimes combined with therapeutic hypothermia, cooling the body, can help patients recover from a rare but devastating complication called spinal cord ischemia that can sometimes happen after major surgery on the aorta.
So a potential rescue therapy, too.
Exactly. So while surgical techniques have definitely improved over the years, reducing some of these risks, having hyperbaric chambers available in major cardiovascular surgical centers is still considered important for managing these complex and sometimes unexpected situations.
It really seems HBO has a remarkably broad range of potential uses in cardiology, from prevention and helping with recovery to actually assisting in major surgeries. Let's briefly touch on using HBO specifically for prevention in heart health.
Okay. Well, while some animal research hints that very high oxygen levels might even help reverse the buildup of plaque in arteries, we unfortunately don't have good clinical studies in humans yet to confirm this preventative or reversal effect.
So not quite there yet for prevention.
Not definitively. However, it might be valuable to conduct long-term studies using HBO in patients who have already been diagnosed with coronary artery disease, maybe combining it with comprehensive rehabilitation programs, especially for those with chronic chest pain or ischemia.
And what about exercise?
There's also a fascinating idea of having patients with chronic heart failure exercise inside a hyperbaric chamber, maybe on a stationary bike or ergometer.
Exercising under pressure with extra oxygen.
Yeah. The thinking is that the extra oxygen might increase the threshold for angina, allowing them to exercise harder and for longer without triggering chest pain,
And the potential benefit.
potentially leading to better blood flow to the brain, improved overall physical health, and maybe, just maybe, even longer survival. But this is still quite speculative and needs proper investigation.
That's a really interesting thought, therapeutic exercise in a hyperbaric environment. Now let's shift to a very serious situation. Shock. How might HBO be helpful when the body's circulation fails?
Right, shock. It's a critical state. No matter the underlying cause, blood loss, heart failure, severe infection, the common denominator in shock is essentially a failure of the circulatory system to deliver enough oxygen and nutrients to the cells and remove waste products.
Leading to cell damage.
Exactly, leading to cellular dysfunction and, if not corrected, cell death and organ failure. It's life-threatening.
And oxygen is key.
Absolutely. While giving regular oxygen can help if the blood itself isn't carrying enough oxygen, like in some lung problems, in many types of shock, the issue is more about delivery to the tissues. In some of these situations, HBO might be needed to really push oxygen into those oxygen-starved tissues and potentially improve the chances of survival.
Our notes mention different kinds of shock. Let's start with shock caused by trauma or severe blood loss, hypovolemic or hemorrhagic shock.
Okay. Interestingly, some of the initial studies looking at HBO for this type of shock weren't very encouraging.
Oh,
However, later experiments showed that giving HBO during hemorrhagic shock could actually raise blood pressure. This seemed to be due to increased peripheral vascular resistance, the constriction of blood vessels in the limbs.
okay, so it affects blood pressure. What about the heart itself?
Well, damage to the heart muscle itself, these sort of zonal lesions, are actually characteristic of hypovolemic shock and can contribute to subsequent heart failure. There's some evidence suggesting these lesions might be potentially reversible with HBO therapy.
Reversible damage.
Potentially. And some research suggests that using HBO early on in the post-perfusion period after someone has been resuscitated from traumatic shock might actually increase the effectiveness of those resuscitative measures.
But not all studies agree.
No, like much of this field, there's conflicting data. Other well-conducted studies, primarily in animal models of hemorrhagic shock, didn't find a significant benefit from adding HBO to standard fluid resuscitation. On a more positive note, HBO at higher pressures, like 3-ATA, has been shown to improve metabolic disturbances in animal models of shock caused by severe burns. And using HBO, along with artificial oxygen-carrying blood substitutes, looks promising in experimental models of hemorrhagic shock.
So, still under investigation, what about cardiogenic shock? That's when the shock is directly caused by the heart failing as a pump, often after a big heart attack.
Right, cardiogenic shock.
Oh.
Here, some of the animal studies are quite striking. Experiments where cardiogenic shock was induced in dogs by blocking coronary vessels show that HBO at 3-ATA significantly lessened the fall in blood pressure, cardiac output and heart rate.
So it stabilized them.
It seemed to, yes. And importantly, it led to significantly greater survival rates in these animal models compared to controls.
That sounds promising.
It does. Some researchers have even suggested that in cases of severe heart attack, we should consider early intervention with both medications and HBO specifically to try and prevent the patient from deteriorating into cardiogenic shock in the first place.
Proactive use.
Potentially. And when someone is already in cardiogenic shock, treatments that help support the circulation mechanically, like balloon pumps, can potentially be combined with HBO to try and get more oxygen to the struggling heart muscle. Sometimes this is even combined with mild cooling, hypothermia, to reduce the heart's oxygen demand.
Is there human data?
One clinical study suggested that HBO therapy for cardiogenic shock complicating acute MI was perhaps as effective, or maybe even better than, using an intra-aortic balloon pump, especially if the HBO therapy was started early.
Interesting comparison.
Yes, but again, overall, while HBO looks like it could be a useful adjunct in cardiogenic shock, we really need more well-documented clinical studies in humans to confirm its role and effectiveness.
Okay, finally, let's delve into peripheral vascular disease, or PVD. This seems to cover quite a lot of ground.
It really does. PVD is a broad term referring to diseases where the arteries that supply blood to your limbs, especially the legs, become narrowed or blocked.
Usually atherosclerosis.
Mostly, yes, arteriosclerosis obliterans is common, but also conditions like thromboangiitis obliterans, Berger's disease.
And then the symptoms.
They can range quite a bit, from pain when walking that gets better, with rest that's intermittent claudication,
Right.
to pain even when resting, cold feet, non-healing sores or ulcers, and in the most severe cases, gangrene, which can lead to amputation.
And critical limb ischemia.
Yes, CLI is the most severe form, often defined by rest pain, ulcers, or gangrene, and it carries very high risk of limb loss and also major cardiovascular events like heart attack and stroke.
So the core problem is lack of blood flow and oxygen to the legs.
Exactly. The reduced blood flow means the muscles in the legs don't get enough oxygen, which obviously affects how they function and how they produce energy, especially during activity like walking.
Our notes go into some detail about what actually happens inside the muscles of people with PVD and how they respond differently to exercise. Can you unpack that a bit?
Sure. Research has shown that in these oxygen-starved muscles, there are measurable changes. You see lower levels of stored energy, like glycogen, and reduced activity of certain key enzymes involved in aerobic energy production.
So they're less efficient.
They can be. Interestingly, though, some studies suggest that the muscle's reduced ability to use oxygen might sometimes be more related to the fact that people with PVD often become less active due to the pain rather than the frequent lack of oxygen itself directly causing long-term negative changes in their metabolic enzymes.
Inactivity plays a role too.
It seems so. There's also evidence that certain enzymes involved in using fat for energy are less active in people with stable PVD. When people with claudication exercise, they tend to build up more lactic acid and extract a higher percentage of oxygen from their blood compared to healthy individuals, suggesting they might rely more heavily on fat for energy during exertion.
Does exercise training help adapt the muscles?
Yes, it does. Just like endurance training helps healthy muscles adapt, the muscles of people with PVD can also adapt with exercise training, improving their ability to use oxygen. Paradoxically, the reduced blood supply during exercise might actually be the stimulus that triggers this beneficial adaptation.
Interesting. What about other metabolites?
Studies looking at amino acid exchange in leg muscles during exercise in people with PVD have also shown some differences, like increased breakdown of certain amino acids in the oxygen-deprived muscles, suggesting they might be using protein for fuel too.
So PVD has some pretty significant and complex effects on the muscles in the affected limbs. How is it usually diagnosed and treated?
Diagnosis involves first ruling out other causes of leg pain, like nerve or joint problems, then a thorough physical exam, checking pulses and measuring blood pressure in the ankles compared to the arms, the ankle brachial index, or ABI.
And specific tests.
Various tests are used. Doppler ultrasound is common to look at blood flow. Duplex ultrasound gives images of the arteries. Plethysmography measures volume changes. Transcutaneous oxygen tension, TCPO2, measures oxygen levels in the skin, which can help assess severity and predict wound healing. Exercise tests see how far someone can walk and how their ABI changes. And sometimes more detailed imaging, like angiography or MRA, is needed to pinpoint blockages.
And treatment.
It's multifaceted. Lifestyle changes are crucial. Quitting smoking is paramount, managing diabetes, high blood pressure, high cholesterol. Exercise therapy, usually supervised walking programs, is very effective for claudication. Medications like cilostazol or pentoxifylline can sometimes help improve walking distance. Antiplatelet drugs like aspirin or clopidogrel are usually recommended to reduce cardiovascular risk.
What about more invasive options?
For more severe disease, procedures like angioplasty with or without stents to open up blockages or bypass surgery to reroute blood flow around blockages are options. In critical limb ischemia, the focus is on restoring blood flow quickly to save the limb.
Given all that background, what's the rationale for using HBO for PVD, and what does the evidence actually say about its effectiveness?
The core idea behind using HBO for PVD is straightforward. Directly increase the amount of oxygen delivered to the poorly supplied tissues in the limb.
Bypassing the blockages to some extent?
Exactly, by dissolving much more oxygen directly into the blood plasma under pressure. The hope is that this extra oxygen can help heal chronic ulcers, reduce rest pain, maybe decrease the need for amputation, and potentially improve overall tissue viability.
What did the early studies show?
Early experimental studies show that while HBO might slightly reduce overall blood flow in healthy limbs due to vasoconstriction in well-oxygenated areas, it significantly increases the amount of available oxygen. Importantly, in tissues that are already ischemic or hypoxic, low oxygen, HBO seems to lead to a much larger increase in oxygen levels compared to just breathing normal oxygen.
And it doesn't worsen the ischemia by constricting vessels there.
Apparently not, according to some studies. It seems that in these oxygen-starved tissues, oxygen doesn't act as a vasoconstrictor until the oxygen levels start to significantly improve. So it helps deliver oxygen without shutting down the remaining blood flow. HBO has also been shown to reduce post-ischemic edema, or swelling, in animal models.
Okay, that's the theory and some lab work. What about the clinical experience with HBO in actual patients with PVD? What have doctors observed over the years?
Well, some of the very first uses of HBO for PVD were reported back in the 1960s by pioneers like Illingworth. He noted it could help save limbs in cases of sudden acute arterial injuries and also provide pain relief and help heal ulcers in conditions like thromboangiitis obliterans.
Promising early signs.
Yes. Later reports in the 60s and 70s mentioned that HBO could help dry out gangrenous tissue, potentially allowing for amputation at a lower, more functional level, like below the knee instead of above.
But not always successful.
No, some studies, particularly in patients with very advanced end-stage disease where the small blood vessels were extensively damaged, found limited benefit in terms of limb salvage.
So patient selection might be key.
Very likely. More positive results have been reported consistently from Japan, where HBO has been used more widely. Dr. Sakakibara, for instance, reported high rates of healing for sores and ulcers and decreased amputation rates in significant numbers of patients with both Berger's disease and atherosclerotic PVD treated with HBO.
Interesting geographical difference.
It might reflect different treatment protocols or patient populations. Some researchers have suggested combining HBO with other treatments, like medications given directly into the arteries or surgical procedures like sympathectomy, might enhance its effectiveness. There have also been successful reports of using HBO in infants born with severe blockages in their peripheral arteries causing gangrene.
Wow, even in infants.
Yes. Some studies using blood flow measurements indicate that HBO might help redistribute blood flow, potentially shunting it from healthier areas towards the more hypoxic tissues that need it most, at least in some patients.
So improving oxygen delivery where it's needed.
That's the goal. Overall, while acknowledging the need for more large, high-quality, randomized controlled trials, there's a considerable body of evidence from clinical experience and smaller studies suggesting that HBO can be a useful adjunctive tool in managing severe PVD. It seems particularly helpful for healing chronic, non-healing wounds and potentially improving limb salvage rates in carefully selected patients.
It certainly sounds like HBR has shown some real promise in treating PVD, especially in those more severe limb-threatening situations. Our notes also specifically mention using HBO alongside exercise therapy for ischemic leg pain or claudication. Tell us about that.
Yes, that's an interesting application. Before about 1989, there wasn't much published research specifically on combining exercise training, like ergometry, with HBO for rehabilitating people with claudication.
So it was a newer idea then.
Relatively, yes. One pilot study conducted in Germany looked specifically at patients who hadn't really improved with standard exercise programs, either breathing normal air or even 100% oxygen and normal pressure.
NBO.
So the difficult cases.
Exactly. These patients then underwent treadmill exercise testing inside a multi-place hyperbaric chamber, pressurized to 1.5 times normal atmospheric pressure, while breathing 100% oxygen.
Exercising in the chamber.
Right. The protocol involved them exercising until they felt the onset of their typical leg pain, then resting inside the chamber until the session ended. They compared this to control sessions exercising under normal air, hyperbaric air, pressure without extra oxygen, and normobaric oxygen.
What did they find?
Clinically, the study reported that these patients did see improvements in how far they could walk on the treadmill during the HBO sessions, even though there were some fluctuations day to day.
So they could walk further with HBO. Yes. And interestingly, the lab tests done before and after exertion showed that they had less accumulation of metabolic byproducts like lactic acid and ammonia in their blood during exercise under HBO compared to when they exercised breathing normal air or even NBO.
Suggesting better muscle metabolism.
It suggests the HBO allowed for more aerobic metabolism during exercise, delaying the onset of anaerobic metabolism and pain. The researchers suggested that HBO helped these patients overcome the barrier imposed by their limited circulation, allowing them to exercise more effectively and ultimately improve their functional capacity for daily activities, even if the underlying vascular disease didn't change.
A functional improvement.
Exactly. They also proposed an interesting idea of a ceiling effect, suggesting that HBO sessions could be continued until the patient's performance under HBO wasn't significantly better than their performance with NBO or room air, at which point they could transition back to regular daily exercise in normal air.
A tailored approach.
Yes, using HBO as a tool to break through exercise limitations.
And finally, just to round things out, our notes briefly mention HBO's role in some other, perhaps less common, artery problems, miscellaneous arteriopathies, and also as an extra tool alongside peripheral vascular surgery itself.
Right. There are indeed scattered case reports suggesting HBO might be beneficial in some rare vascular conditions. For example, a child with severe allergic vasculitis who wasn't responding to conventional treatment reportedly improved significantly with HBO, perhaps by interrupting a cycle of blood vessel wall ischemia and swelling. Another case involved accidental injection of drug into an artery, causing severe vasospasm and threatening the limb. HBO combined with other treatments was credited with saving the arm.
Wow.
Successful treatment of ergotism, a condition caused by ergot poisoning, leading to severe vasoconstriction with HBO and epidural blockade, has also been reported after other methods failed. And more recently, a case of livedoid vasculopathy, a painful skin condition related to small vessel clotting, reportedly responded rapidly and completely to HBO therapy.
So potential uses in rarer conditions too. What about alongside surgery?
Yes, as an adjunct to peripheral vascular surgery. Some surgeons have reported that using HBO postoperatively in patients with very severe vascular disease who underwent difficult reconstructions helped improve limb salvage rates. They emphasize, though, that HBO was an adjunct to successful surgery, not a replacement for it.
Making the surgery more likely to succeed.
Potentially, by improving tissue oxygenation during the critical early healing phase. It's also been used successfully in cases of severe vascular trauma, for example, in young men, where the initial surgical repair was technically okay, but didn't immediately restore adequate blood flow. HBOs seem to help prevent gangrene in those situations.
Supporting the surgical repair.
Exactly. And of course, HBOs establish roles in treating things like chronic refractory osteomyelitis, bone infection, or certain problem wounds, which can sometimes complicate PVD, are also relevant here, though reviewed elsewhere.
Okay, this has been an incredibly comprehensive deep dive into a really vast amount of research on HBO in the cardiovascular system. To try and bring it all together, what would you say are the key insights or takeaways we should leave our listeners with?
Well, I think in summary, our exploration today really indicates that hyperbaric oxygen therapy shows, I'd say, significant potential as an additional treatment across a pretty wide variety of cardiovascular conditions.
It's popped up everywhere.
It really has. This includes acute situations like heart attacks, ongoing conditions like chronic ischemic heart disease and angina, certain heart rhythm problems, potentially heart failure, and also the diverse spectrum of peripheral vascular disease.
And the potential benefits seem varied, too.
They do. The evidence we've discussed from both animal models and human studies suggests that HBO may offer benefits such as reducing the amount of tissue damage after a heart attack or stroke, improving blood flow and oxygen levels in oxygen-starved tissues, potentially speeding up the healing of difficult wounds, and enhancing the ability to exercise in some patients, particularly those with claudication.
But, and it's a theme we've hit on throughout, the full picture is definitely still emerging, isn't it?
Exactly. That's the crucial caveat. While the findings from many laboratory studies and quite a few smaller or observational studies in humans are certainly encouraging, sometimes quite strongly so, there's a clear and pressing need for more large-scale, rigorously designed, randomized controlled clinical trials.
The gold standard evidence.
Precisely. These larger trials will be absolutely crucial for definitively determining the specific role, the true effect size, and the optimal use of HBO in treating different heart and blood vessel conditions. And importantly, for identifying which specific patients are most likely to benefit from this therapy.
So here's where it gets really interesting thinking ahead. Considering this incredibly complex interplay between oxygen, blood flow, and cardiovascular health, and all these promising yet still often developing findings across so many areas, what might future applications of precisely targeted oxygen therapies, maybe including HBO or even newer approaches, look like in both preventing and treating diseases of the heart and blood vessels down the line? That's the big question.
It really makes you think about the possibilities that lie ahead in this very dynamic and evolving field. Thanks for joining us for this deep dive.
Thank you.
And we really encourage you, our listeners, to continue exploring this fascinating area.